PNG's population is 11 million. 50% are children still under parental care. This is putting a strain on the government services and infrastructure.
There's no way a government can organise schooling for more than 50% of its population. Who's going to pay for all this schooling? Well, these poor people who are not in less than 18, they're few in number, and so it's just not possible for any government to organise health services and infrastructure and education when we're all having so many babies and producing the structure of our population with.
Professor Mola says the population explosion will impact the country's economic development.
Who's going to run the country? Who's going to produce all the income? Who's going to organise the health services and the education? It's just not possible with this kind of structure of your population. So that's why it's a national emergency.
Every year, the population increases by 300,000 due to the lack of family planning and contraception. Research Institute Director Dr. Osborne Sanida acknowledges the advantages of population growth from an economic point of view because it boosts the labor force. However, lack of health and education facilities to cater for the growing population will increase the number of people dependent on their family for support. Dr. Mola called on the government to take population growth into account by re-establishing the Population Council, provide more people with family planning help, make population planning a subject in schools, and consider introducing small family incentives. Gladys Killer, National EMTV News.